So, Mr. Aslam, can you tell us a little bit about, obviously, how sort of Harley Street sort of began and what the buzz is about coming to Harley Street to have a treatment?
Well, Harley Street has been going on for about 150 years. Essentially, once the street had been set up, this was a convenient place for doctors to go to King's Cross and Marylebone Station, where we would be travelling to different people to attend to them. And then they started sitting here, and that's how the whole thing started. And then by 1900s, there were about 200 doctors here.
Oh, wow.
And by 1948, there was about 2,000 doctors here. That's when the National Health Service started.
Let's go into your clinic, and I heard that you do something a little bit different, and that you do your surgery, some of your surgery under local anesthetics. Well, I'm keen to have a look.
We do perform a lot of operations under local anesthetic, purely under local anesthetic, sometimes combining them with a little bit of sedation, which is called conscious sedation, and very rarely combining them with deep sedation. When you're doing a local anesthetic, your patient is awake, he tells you or she tells you precisely what kind of pain they are in. Yesterday, we did a breast reduction on a patient. Now, mind you, it's a large operation. A lot of people think, oh, breast reduction in local anesthetic. It can be very safely done in local anesthetic. The beauty of the operation in that particular lady was that she wasn't sure what precise size and shape she wanted. So what I did was, I did one breast. We set her up. She looked in the mirror herself and she said to me, yeah, that's fine. This is what I would like to achieve. So she could have made a decision there and then that, oh no, I want it a bit smaller or a bit more lifted and all that. So that in certain situations, it gives you a lot more control because you can get the patient involved. But I think personally, the best thing about local anesthetic is the post-op. The post-operative recovery, you just sit up, you go into your room to recover, and you start eating and drinking straight away. In an hour and a half, you're ready to go home.
So we're in the heart of London in Liverpool Street, and you've got a nice little practice down a very quiet street, but there was something really interesting you were telling me about how it all sort of started.
Yeah, well, it's a very quaint street in the side alleyways off Bishopsgate in central London, and it's a listed building in a conservation area. And what's more interesting is that it's an area of London that has a high incidence of Roman ruins. So when we were doing the refurbishment works to create the practice, this was a disused building that hadn't been used for 7 years, so you can imagine it was in a real state. And we had some digging work that needed to be done in the basement. And the local council wouldn't let us do this work unless an archaeologist was watching all the digging work. But we did find some pottery and some coins and some bits and pieces.
Straight onto eBay?
Unfortunately, I've made no profit out of it, so it didn't pay for any of the building work. But it made for an interesting time when the work was going on.
I mean, what are the typical patients asking for at your practice?
Most patients are looking for a straighter, whiter smile. And I think adults have now discovered that really there is no age limit to braces. So typically we're seeing a lot of adults who either didn't have braces as a teenager and regret that decision but have realised it's never too late, or perhaps they're noticing that their smile isn't what it was and the teeth are moving, and so they want to make a change at that point in their life.
Do you find people in London actually have time to have dental treatments?
I think they are always in a rush. We're right in the financial district. You know, you've got the headquarters of some of the biggest banks just to our left. So they are in a rush. They're usually coming from one meeting to the next, and they're always on their Blackberries. But the reality is that they do want to make a change to their appearance. You know, we're in an appearance-conscious society. They're going to meetings. They want to make an impression, and so teeth are a very important part of that. So they do make the time, and it's usually around their lunchtime or after work. We open late in the evening, so they're coming to see us in the evening and making the time for that.
Well, I think you've given us a real insight into what Londoners want in terms of dental treatments. So if you want to find out any information about some of these treatments, go to My Face, My Body.